Yeah, I think we on. Welcome to the first episode of Health Agenda. This is a platform where we bring health experts to discuss on the various health issues we are faced as a society and solutions thereof. And today we brought you a great and passionate guest, Dr. Pat Moswane. Just a bit of a background on our guest. Dr. Pat Moswane is from Ramasamola, one of the villages in Limpopo, and he obtained his MBCHB from Sefako Health Science University. In short, is called SMU. And now he practices as a second-year medical intern at Mukopane Regional Hospital. Dr. Moswane's interest is rendering quality medical services to the general public that cannot afford medical aid. Yeah, this is one of the greatest things in medical fraternity, getting people access to quality medical services, and having a young intern like yourselves trying to go about solving this big issue. This is a global kind of crisis where we want to have like a universal coverage. So I think one should be hopeful having trying to tackle this kind of issue or being one of your interests in the field. So please join me in welcoming Dr. Pat Moswane to our first episode of Health Agenda. Before we start with our theme of the episode, firstly, since you are an intern, and it's quite unfortunate, or we are fortunate, we have the pandemic that it's global. I mean, you are an intern, a lot of pressure. You still trying to navigate through the system and then trying to readjust. I mean, how are you holding up? It must be hard, I can.
Yeah, thank you for the introduction.
Yeah,
And it's a pleasure to be a part of your platform. And yeah, back to
yeah,
your question. Yeah, it's been tough on everyone, the pandemic, and I don't want to lie,
mm,
especially for us as health workers, because
mm,
different protocols are coming out on how to manage. And then I'm sure you've seen in the news that they were recommending this drug. Then after trials, they would recommend another one. So it was just difficult having to explain to the public, to people, how we are managing this thing, and also socially, gore, o palelwa ke go ya gae, o a bone kwa gae, because you might
yeah,
risk infecting them. Yeah. So overall, it has
yeah,
affected us just the same as everyone in our country and everyone
yeah,
in the world.
yeah,
Yeah.
yeah, yeah. Oh, I can imagine, man. I
Yeah.
think, yeah, in business, socially, and everything else is being impacted. But then we're
Yeah,
learning.
definitely.
We can sort of now anticipate these kind of things in the future. The only thing to do is to survive and to prep ourselves for the next episode if this thing happened to come again. Maybe it might be a
Yeah.
whole new different thing. So the
Yeah.
theme of our episode today is correlation between food and lifestyle diseases.
Okay.
Uh, like I said, as I looked at this interest of yours in the field, which is getting quality medical services to the general public that cannot afford medical aid, that cannot afford, medical aid. So I would say when one thinks about access to quality medical services to the general public that cannot afford medical aid is sustainability. Before you can
Definitely.
even, yeah, go about solving the problem, I think the biggest thing here is sustainability. Will it be sustainable, of course? And
Yeah.
I'll say there are several factors that must be in place to sort of sustain the model that you will be employing in trying to bring these quality medical services to the general public, which I assume they have to be affordable. So
Definitely.
yes, So there are two fundamental things that, that we consume as human beings, that are the driving factors to this sustainability, which are food and content. You know, as human beings, we consume these two things, food and the content. Content is, you know, it has to do with what goes in our head, information, yeah. So I'll perhaps start with the content itself. Why do you think it is important for health experts like yourselves in the community to engage or partake in health education programs like this one to educate communities on health related matters?
Oh, okay. Well, that's quite easy. Thing is, you look at the background or the epidemiology of most chronic diseases in our country and also around the world. It's really fascinating to when you look back and study that most of these chronic lifestyle diseases that we have
Yes.
were mostly due to in the Western world. And then, however, due to urbanization and globalization, they are also affecting us as African countries. So the studies have shown that most of these diseases can be managed via lifestyle modification and diet. So it's important as health education, as health experts like us who have read and studied these and who have a background knowledge of this, to educate those who may not have access to such information, like people who don't have access to the internet, people don't have access to TV, people don't have access to media in general, that when they come to our health establishments, we try and give them this information, because you know they're saying that people believe what they hear. So we need to inform them, empower them, so that should it happen that they can come to the hospital and maybe, let's say, for instance, one day medication runs out of the hospital, they have the information on healthy lifestyle habits which they can use to control their diseases.
Yeah, quite fascinating there. I think it's so inspiring as well. I mean, as doctors, we looking up to you guys. I think you carrying the nation like that, and then also this health education thing coming from your side as a doctor is sort of credible, because people go to internet, they search. I mean, the sources that they come across, they might not be credible. So it's so important. I think you gave a very relevant answer right there. So the second part, which is now the food part, like we come from the content, now we come into the food part. Why do you think food that are sold in our communities should be sort of regulated? Because I believe food are the driving factors for chronic non-communicable diseases. So I'll assume that food has to do with, those chronic non-communicable diseases has to do with the food we eat and are sold in our communities, in our local complexes. I mean, you can imagine now people drinking a lot of soft drinks, and then here we're having a problem of diabetes. Why do you think food that are sold in our communities should be regulated, not only on our spaza shops, but also in the big retailers from our closest or local complexes? Why do you think that the food sold in our community should be regulated?
Okay. Yeah, the food definitely should be regulated, because you look at the market, most companies, most manufacturers of food, they are consumer based. They just want to sell their products, regardless of whether the product is healthy, whether the product is good, whether the product is full of nutrients. So the need to regulate is to take care of our community, because as you've mentioned, there's a lot of high consumption of unhealthy foods nowadays. There's fast food restaurants. There's lots of soft drinks being sold. There's a lot of even food which is claimed to be organic sold in your fruit and veg shops. The food, you look at how it was farmed, the use of pesticides, the use of all other chemicals which affect the quality of the food consumed by the people, eventually leads to developing such diseases. So it is very, very important to educate and regulate the food, because a healthy food leads to a healthy society.
Yeah, great. There, I agree with you there. I think having the support from health experts like yourselves to get the food that are sold in our communities regulated, that will be a fascinating move, because
Definitely.
before we even try to bring the universal coverage, these are systems that we need to put in place before, so that once we have
We have
this
to start
model.
at the basic level.
Yes. So it is quite important to have that.